which will achieve virechan should be given. And then for basti, we will discuss in details about all these bastis because those are important. Now we have discussed about poshtha shodhana by shodhan chikitsa or panchakarma, and now chedan and lekhan should be done while we are dealing with the srotasa shodhana or eradication of dosha and constituents which are there in Sukshma Srotas. So Chedan and Lekhan Chikitsa are equally important. We can see the drugs and which are utilized regularly in Saulya Chikitsa, Yavakshar, Maricha, Shilajitu, Madhu, Vacha, Poshana Jala and Yava. So drugs as well as diet both are included over here, and we will see these details later on. So please think about continuous Chedan and Lekhana Chikitsa for Sroto Shodhana and for relieving Marga Varod which is there in the channels, that is Srotasa. Now in Basti Chikitsa also, let us not depend only on Lekhana Basti, because as Lekhana Basti contains Gomutra, that is cow urine, and Yavakshara. This Kshara and Mutra sometimes may cause abdominal pain and burning sensation. So we should be always ready with plan B, plan C, or the alternative in Basti. And these Bastis also can be given. Those are namely Utkleshana Basti, Doshahara Basti, Shodhana Basti, and Madhutailika Basti. So ingredients are mentioned over here, and these Basti will also achieve Medo and Kafagna action as well as Sroto Shodhana. So these Basti can be given to patient to achieve weight loss as well as Medogna Chikitsa. These are two different combinations of Lekhana Basti, as Lekhan Basti is supposed to be the very beneficial treatment for patient. But what I have seen in my 20 years of practice is not only Lekhan Basti, but even Yoga Basti when given to obese patient who are having more of fluid component than fat component gives better results. And Lekhana Basti also gives good results in patient, and patients who are having stubborn fat in them will require further repeated courses of Lekhana Basti as well. So there are two combinations. One combination has decoction of multiple herbs which are mentioned in the bracket. Another combination has Triphala. So whenever you are doing treatment in charitable hospital, maybe only Triphala Quath also can be used. Then along with that, rather than mixing Tilatel, Sarshapa tail is mixed because Sarshapa oil is said to be better for management of Sthaulya. Honey, Yavakshar, Saindhav and Gomutra. This is the combination, but as per patient requirement, we can formulate or we can change the or alter the combination, and as per patient requirement, we can change the medicine. Now, when we come to local treatments, why local treatments are important? Because local treatment will not interfere with the body metabolism as oral drugs will interfere or impact. So in local treatments, all of us know that Udvartan, Udgharshan is the main treatment which should be done. And retrograde powder massage by rubbing, vigorous rubbing should be done. And drugs used are Triphala, Nimba, Musta, Vacha, Shunthi, ash of cow dung if you utilize for Udgharshan, especially for abdominal obesity, gives very good results, and it can be seen also. Then there are multiple chikitsa. Lepa chikitsa is generally indicated for another important thing is that Triphala tail is also mentioned. So that also can be used for Basti as well as Abhyantar Pan as well as Snehan also. In Lepa chikitsa, basically lep which are mentioned in our text are indicated towards the Daurgandhya Nashana and Swedo Nashana action. Those are less useful for Medo Lekhana. But obviously, a drug that is causing Svedana as well as Daurgandhya Nashan will have little effect on Medogna, will have little Medogna effect as well. So Swedan should be given to patient. If patient is having stubborn fat, then think of Kuti Swed, Jentak Swed and other Swed which are definitely stronger if patient can tolerate and if patient is having stubborn fat. But if patient is having loose fat which needs to be removed, then Peti Swed or Bashpa Swed can be sufficient. And in patient who are having Pitta constitution, Guru Pravarana and as well as Ushna Avagaha or Ushna Koshana or Ushna hot water bath will also be sufficient. Basically, prefer Anagni Swed for Pitta constitution, but for Vata and Kapha, these Swedana Agni Swed can Sa Agni Swed can be utilized. Now, in Shamana Chikitsa, what should be the aim? Pacifying measures should be given for basically vitiated dosha, for lekhan action and tarpana chikitsa. Tarpana chikitsa, the way we discussed, for nourishment, daily nourishment of dhatu and body constituent should be done. Otherwise, vata vruddhi and langhana lekhana will lead to vata prakop and dhatu kshay and daurbalya. And most important thing is it will not help in weight loss, but it will only increase daurbalya or weakness. So that should not be there. So Shamana Chikitsa is basically a Punarbhava Chikitsa also. So patient can maintain on its already lost weight and so patient can have a healthy life. So when we are thinking about drugs in Ayurvedic management of the Shaman Chikitsa of the patient, I think I will have to wind up a little because my 1 hour will end soon. So we will discuss about the main points about all these drugs. Gugud should be given as we use Gugud basically for Asthi Majjagata Vyadhi or mouse and so a person who is having any osteoarthritic changes should be Gugud, which is Nava Gugud, because that will act as Bruhana. Now we can give Bruhana. We want to deal with osteoarthritis, and that's why processed Gugud can be utilized. So to take care of osteoarthritis, but if our whole and sole intention is weight loss, then Zuna Gugul, that is old Gugul, should be given because that is having Lekhana action. So make it sure what is the indication for using Gugul and then only use Gugul. Now Shilajit is the best drug. Why? Basically because Shilajit is Lekhan also. Shilajit is boon for who are having the constitution, who cannot have Gugul for longer duration. So Shilajit should be given in Vata Pittaja Samprapti and Gugul should be given in Vataja Samprapti. Triphala, all of us know, is a very good drug. Triphala has multifold actions. Triphala Kwat can be used, Lekhana Basti. Triphala Churna along with honey can be given as Rasayan as well as Medogna action. Only Avla can be given because it is having Vayasthapan action. And we have already seen that in Medo Roga or Sthaulya, there is Ayushor Hasaha Javoparodhaha. So Avla can be utilized in multiple ways. According to me, if a person can use fresh Avla, gives better results than Amalaki Churna. So try giving Amalaki separately. Though you are giving Triphala Churna, still give fresh Amla with honey to a patient for Vayasthapan action. And that will definitely improve Dhatu Samhanan as well as Dhatu Saratva. Because it is a Rasayan and Vayasthapan Rasayan, it will definitely help. If you feel that person is very obese, then in Triphala also you can increase quantity of Haritaki compared to Amalaki and Bibhitaki and use it. Another drugs which can utilize Nagar Motha. Musta is a drug which should be given initially when we want to have weight loss with body water retention. Means weight gain is because of water retention and water retention, then Musta is the best drug. If water and fat both need to be removed, then Musta, Haridra and Vidanga combination will give better results. If Agni Mandya is there, then second drug, that is Chitrak, will be useful. If Dhatu Agni Mandya is severe, then Chitrak is useful. Chitrak will be utilized in obesity along with hypothyroidism also, because it is having very good Dhatwagni Mandya action. Shunthi, as it is very useful, Shunthi, Marich and Pippali. Trikatu can be given for Vata Kaphaja, especially Kapha Pradhan ailments, along with honey for scraping action. Devdaru is utilized. Atasi, flax seeds, nowadays everyone eats after having food, for having good digestion as well as having good metabolism also. Kanchanar and Kukutnaki, these two drugs are basically indicated for localized obesity. What is localized obesity? If lipomatous formation is there or medoja granthi are there in multiple numbers, then Kanchanar and Kukutnaki will give better results rather than in using Kanchanar Gugul for basic. It is basically indicated for Granthi and Arbut. So rather than I use it for Medoja Granthi rather than utilizing it for solo Thaulya. Tuak and Tuak Patra. All of us know that Tuak is proved to be having dyslipidemic action, sorry, antilipidemic action. So, Tuak Siddha Jala or Tuak Churna with honey is given for fat which is there in blood. That is, if lipid saturation is high in blood and lipid profile is deranged, then Tuak can be utilized. Yava is the diet, I would say, for obese patient, and Yava can be utilized in n number of ways. There are some do's and don'ts while having Yava Ahara. Those should be instructed to the patient, and then we can use Yava in ample quantity. Along with Yava, all Dhanya, that is we term as millets, all millets will be very useful. Obviously, sir will focus on that particular point, so I won't go in details, but all millets are, or which we term generally as Kshudra or Kudhanya, can be utilized very well for Chikitsa of Staulya. Kukutnaki and Agnimantha. Agnimantha is a very good drug. A person or a patient who is having Amavata and Staulya, Agnimantha would be the drug of choice. Another Shamana Aushadhi can be enlisted. There are hundreds of drugs. I have a list of all those drugs. Almost 142 combinations are mentioned in various Ayurvedic texts, and we in our institute are having research projects also. Vidangadi Churna, then Vachadigan, Haridradigan. We have already done research on it, and it has proved to be very good. But for all Ayurvedic researchers, academicians, and students, I would definitely request that once you see the combination or particular yoga or kalpa, just try to understand the pharmacokinetics of that particular combination, and then only use that particular drug, because every drug cannot be utilized everywhere. So if you understand the particular combination, for the requirement of your patient, and then choose the drug accordingly, so that with lesser dosage and lesser treatment you will get better result. So Eranda and Babula are also useful. Badar is again a useful drug. Bijaka and Atimundi, Jambu, Haridra, Patola, Shakotak. Shakotak, all of us know, is utilized for Medogna action, especially in lymphatics, that is for Shlipada. So if that sort of disease is there, which is complication of obesity, sometimes I will not say that it is lymphangitis and Shlipada. Shlipada in Ayurveda and obesity. Then Shakotak can be drug of choice. Honey is very useful, but always mention, generally people take 1 glass of water and 1 spoon of honey. That will not be useful. 1 part of honey and 4 parts of lukewarm water, that much concentration of honey will be helpful, not in cities like Mumbai or Nagpur, but in cities like Mahabaleshwar, Satara, where you get a lot of cold. So in such weathers, Desha Vichar is also important. So honey as a treatment for Sthaulya can be given at such areas. And another combination can be honey and ginger mixed, and 3 grams of it can be taken early morning before food. Gomutra is another drug. Many patients drink Gomutra in the early morning. Stubborn fat, then only give Gomutra. No pitta vitiation, then only give Gomutra, not otherwise. There are different group of drugs mentioned in Sushrut Sutrasthan, and all these groups have their specific indication for Medogna action. Generally, for Lekhan Basti and Utleshan Basti also, Ushakadigan is mentioned, Salsaradigan is mentioned. Drugs in this particular Gana, here Khadrakta Chandana, Shirisha, Asana, Arjun and Agaru. All these drugs are available. So these drugs are given as Nirupa Basti, path of these drugs, and it is very useful in case of Sthaulya Chikitsa. All these, Valli Panchamu, Kantak Panchamu, we are well aware and can be given for Basti Chikitsa as well as oral treatment also. There are other drugs as well, so those also can be utilized. Now, there was specific mention about the abdominal obesity. For abdominal obesity, Lauha Rasayan, Lohasav and Loharishta are best preferred drugs. Obesity many a times is associated with anemia as well as rasakshaya, because patient try to have different diets on their own, and then they lie down into rasakshaya and shabda sahishnutta and all such complications, but weight does not reduce. But for weight loss as well as for replenishment of all such nutrients, Lauha Rasayan can be given. Varunadi Quath is very good drug for abdominal obesity. Chitrak, Kutki and Trikatu is a very good combination for abdominal obesity. We are using it in our OPD of our hospital. These are various combinations, but generally all Ayurvedic physicians, the way well-known Ayurvedic physicians say that don't go for the combinations. First, see what is pathophysiology constitution of your patient, and then go on searching the drugs for the patient. So, all these drugs can be utilized in patient for management of obesity. The way we just discussed, Vidangadi Loha. Suppose patient is having good dhatu, then give Vidangadi Vataka. If patient is having anemia and obesity, give Vidangadi Loha. Other drugs are also mentioned, but because of lack of time, I won't go in details of each and every combination. Whenever patient is having fatty liver and obesity, obviously drugs like Arogya Vardhini can be given in combination with Triphala, Madhudak and other drugs. So these are various Churna, Gugul Kalpana, Quath, Agnimanta, Triphala, Patradi Kashai, Shirishadi, Shaileyadi, Udvartan and other drugs. These are shaman drugs, especially Taila. I have also already mentioned about Triphala Taila. Lay are also mentioned. So these are the references. You can go through the references, search the drugs and use them with your discretion. About Vyayam, only 5 minutes I will take. Vyayam should be advised as a lifestyle modification and not for 1 month, 2 months or 6 months. And Vyayam protocol should be given to the patient as per the constitution and body, not only body constitution, but the sahatva of the patient. And that can be decided. Yes, here in this particular slide, it is mentioned that yoga, basic sun salutation, Surya Namaskar, in spite of Prakriti, Sukumaratva or anything, every patient can do. There are n number of YouTube videos also for patients who cannot bend down and also modified Surya Namaskar position by sitting in chair is also given. So all such modification, when there is will, there will be a way. So a person or a physician who wants to give treatment to a person who is willing to reduce weight should advise all such things, but kindly accept the particular thing that it's a combo offer of Pathyakar Ahar, Uchit Vyayam as well as Aushadhi. Then only person can achieve desired weight loss, not otherwise. In different yogic postures or asana are also useful. Pranayam, especially Kapalbhati, Bhasrika, and Sinha Mudra, which are intended towards increasing metabolic rate, are useful. Nadi Shuddhi Pranayam, Surya Bhedan, and Shankha Prakshalan, if done with proper yogic guidance, will give very good results. Nowadays, there is colon hydrotherapy. Okay, newer thing has come up for obesity. So if Shankha Prakshalan and all such things are done with proper yogic observance, then you will not require colon hydrotherapy and other sophisticated treatments. Then exercise as per the constitution for Kapha Prakriti, Pitta Prakriti, and Vata Prakriti. Set of exercises or type of exercises are enlisted over here, which can be advised to the patient. Now, there is one concept of Ajirana Manjari. Many a times what happens is a person who lives in Konkan and wants to reduce weight, if we tell him to cut on rice, then that is difficult or that is not possible. So a person who is basically not addicted but loves to have these things which will induce obesity or which will tend to which because of which patient will tend to put on weight, then sort of antidote is mentioned in our Samhitas, that is Ajirana Manjari. Generally, it is mentioned for a person who is having it in excess. But I am telling it here that who is having it in regular diet. So these patients, if can have these antidotes, will help them. It doesn't mean that keep on eating maida and then have cucumber, that will help you. That is not the case. But if you are having them, try to reduce them, and once in a while if you are having them in excess quantity, try to have the antidotes. That will be useful. Behavior therapy means that there should be continuous effort for weight loss and weight management. It's not a task for limited period, because weight loss and weight management, you will lead to a healthy and swastha ayu, and that is the motto of our Ayushya. So goal is weight maintenance and prevention of weight gain. So treatment is given for weight loss, then weight maintenance and prevention of weight gain. So threefold treatment will be essential. These are the references which you people can go through to go in details of the management of sthaulya or obesity. Thank you. Thank you, Dr. Daga sir and organizers, for giving me this opportunity to share my views about the management of obesity by Ayurveda. Thank you so much. Thanks for your patient listening as well. Thank you.
Thank you very much, madam. Thank you for your valuable and very informative session about obesity and its Ayurveda management. Thank you so much. Now, I will request our MUHS observer, Dr. Meenakshi Amrutkar madam, if she want to give some remark. Please, madam.
First of all, I am very much thankful to Maharashtra University of Health Sciences for giving me an opportunity as a university observer in this webinar. Speakers of this webinar are Dr. Mukund Sabnik sir and Dr. Anaya Patrikar ma'am. I know personally both of them. They both are clinically sound, especially in obesity. What to say about Sabnik sir? Sabnik sir has huge work on obesity and having huge data too. I personally heard sir's lecture many times, but today we can't heard sir's view regarding obesity because of some technical problem and surprise visit of NCISM of college. Otherwise, overall webinar is good. Lastly, I want to say thank you and congratulate to Dr. Danga sir and his organizer team, especially Dr. Seema. Thank you.
Thank you, madam. Now, now I want to thanks to Dr. Mukund Sabnis sir as the first speaker of this session, and Anaya Patrikar madam especially. See, both of them have spent their valuable time and put many inputs in the webinar. So thank you so much, madam. Again, I want to thank our principal sir, our management for giving permission for this webinar. I want to thank MUHS for using for giving permission for endorsement. So I want to means I'm sorry that there was some disturbances because of surprise NCISM inspection. So thank you. YouTube link and video will be shared in the group. So don't worry. Zoom recording is there with us. And previously in April of month, we have conducted one webinar. Dr. Mukund Sabnis sir. So that lecture is also we have in Zoom recording. We will share all the recordings to you in the group. Don't worry. So I declare that the webinar is over now. Thank you to the speakers, attendees, and faculties and students. Thank you so much.